On today's episode, I answer the question, why did my cat develop a urinary blockage? I discuss, can a brace help after cruciate ligament rupture? What should I feed my cat is another question. And then my cat has kidney failure and needs IV fluids, but my vet doesn't have overnight care. So what are my options? And then finally, is it okay for a puppy to have an anti-rabies injection at the age of 2 months? But first, let's cue the music.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi, and welcome to episode 5 of the Dr. Alex Answers show. I'm Dr. Alex, the vet behind ourpetshealth.com, where my aim is to help you and your pet to live a healthier, happier life. And I'd like to thank you so much for joining me today, sharing your earbuds with me. And if you're new to the show and you enjoy the episode, be sure to subscribe to the podcast. I've got loads more valuable episodes lined up that you won't want to miss. You can also get your question answered simply by heading over to dralexanswers.com. Right, so my first question is all about a cat who developed a blocked bladder or a urinary obstruction. Now, they couldn't afford everything that was recommended, but they did do some blood work and some urine testing, and the cat was then sedated and had the urethra unblocked. They didn't do any x-rays, but the urine didn't come back as having any crystals in it. The blood came back negative for an infection, and they could have discussed that their cats eat a raw diet and they're indoor cats. And the only thing that they did differently was grow some catnip that he had access to. And they were wondering if that was the cause, or really, were there any other ideas? What are the possible causes for a blocked bladder in a male cat? Well, there are a number of causes of an obstruction to start with. Now, they mainly are idiopathic cystitis, and I'll discuss that in a bit more detail in a minute, but also bladder stones and infection. And other things can then look very similar as well that can cause a cat to strain, to either leak small amounts of urine, or actually just appear not to be able to pass urine properly. And that can be things like nerve damage, it can be bladder tumours, and it can also be constipation. That can actually look like a cat straining to pee. Conversely, a cat that's straining to pee is often mistaken for one who's constipated. So that's something to bear in mind if that's something that you think your cat's ever suffering from. Now, unless the catnip was causing a lot of stress, then it's highly unlikely related to this blocked bladder. Catnip really generally does the opposite. It tends to relax cats rather than stress them out. Now, kind of, as I mentioned, the very first cause, that's something called idiopathic cystitis, and that really is stress related. So it's generally not a bacterial infection. It's generally caused by stress, and that happens in stressful situations when there is also an underlying genetic susceptibility. So obviously not every cat is going to develop a blocked bladder, but if there's an underlying genetic susceptibility, then they're definitely more at risk of developing this condition. And equally, a cat going through an idiopathic cystitis flare-up is not necessarily going to become blocked. Certainly female cats, they never really become blocked because the tubes are a lot wider, a lot bigger, and don't narrow and have the same anatomy as in a male cat. But yeah, not every cat that develops an idiopathic cystitis situation will become obstructed, but it's a definite risk. Now, urine culture is needed to rule out a bacterial infection, as it won't always result in changes in the blood. So that's definitely something to consider. And then also bloods really are generally often run instead to check for kidney levels, to check salt levels, which can then impact on treatment given and the prognosis for recovery. Equally, urine crystals won't always be present if there is a bladder stone present. So that can be confusing as well. So to rule out a bladder stone completely, then x-rays or ultrasound are needed. But like I say, the vast majority of cats don't have those things. And then the last thing to mention is that after an episode has occurred, then there is a reasonable risk of recurrence that needs to be managed. And we can do that by reducing stress. And there's a number of ways that I've kind of discussed before and over on Our Pets Health about that. We can increase water intake to have a flushing effect. So rather than a concentrated urine that sits there in the bladder and gets a lot of sludge built up, we get a more dilute urine and the bladder is actually flushed on a more regular basis. And then also after a case of urinary obstruction or a blocked bladder, dietary modification is very important as well. And so while wet food is great because that also increases water intake, there are specific diets that have been proven to really dramatically reduce the frequency of flare-ups of this idiopathic cystitis, and also reduce their severity as well. So, further reduce the risk of an obstruction from forming. So really those are the most likely causes of a blocked bladder. As for kind of treatment of cystitis, reducing stress, increasing water intake, head over to ourpetshealth.com where I've got an awful lot more information about that. Before we jump into the next question, this is the perfect time to let you know that this podcast is brought to you by the ourpetshealth.com Guide to Stress in Cats. This is the free guide that helps you recognize the signs of stress, a problem that often goes unrecognized, and it gives you steps to take to help your cat relax. Get your free copy today. Simply head over to ourpetshealth.com/resources.
You're listening to the Dr. Alex Answers Show.
Okay, so question number 2 is about a dog who has got an anterior cruciate or cranial cruciate ligament injury, and they're wondering if a brace can help the repair and the healing process after cruciate damage. So cranial or anterior cruciate ligament rupture, it can be classed as partial or complete. So a partial rupture is almost like a little bit of a fraying of that ligament, whereas a complete rupture is when it's completely given way and it's no longer intact. Now, presumably by this being described as a mild, this is a partial rupture, so it's still very painful, but the joint itself might be still pretty stable. So when the ligament completely goes, the joint becomes very loose, it's very unstable, it causes a lot of pain and causes a huge amount of problems. Now, a partial rupture is still definitely painful, but it's one that can potentially settle down without more serious intervention, but we'll come on to that in a little bit. Now, there are a number of braces that are available, but personally, I'm not aware of any evidence that they actually improve healing, they improve comfort, or they allow more exercise or have any other benefit. Now, if you go onto these websites, there's a lot of testimonials, there's various videos, but testimonials, anecdotal evidence, and a few videos don't necessarily represent what's going on. For example, a video of a before and after might also be that before video, the dog hadn't had any pain relief, and then the after video, they'd actually had some pain relief. So, that was while they were walking on their leg better. Now, I'm not suggesting that everyone's going out to their way to deceive you, but it's certainly things like that we really need to bear in mind. So there have just been no studies done that I'm aware of. That, of course, doesn't mean that they don't work just because there's been no studies done, but my concern would be that the dog anatomy is not the same as humans, in that their upper legs really aren't a constant fixed diameter, and they don't really readily allow a brace to be placed that, in my mind, would be firmly enough fixed in one spot to only allow the normal rotational movement to take place, or the movement through one plane to take place, and prevent other slipping forces acting on the knee. So, braces are something that is used a lot in human anterior cruciate ligament damage, but I don't know that that's necessarily easy to replicate in dogs. So what can we do? Well, rest is going to be crucial. And also in most cases, actually, although we can rest and we can give painkillers and it might settle down, in most cases, even with a partial rupture, unless it's very, very mild, then surgical intervention generally represents the best chance of recovery for a dog with a partial or a complete rupture. Now, with a mild rupture, like I say, rest and anti-inflammatory painkillers may be completely appropriate. But when things are more serious, or when there's a complete rupture, really for dogs weighing less than 15 kilos or about 30 pounds, if they're managed conservatively, then about 80% of those will recover to a satisfactory degree. So they either won't be lame at all, or they'll only have a mild lameness every now and then. Of course, that then leaves 20% or 1 in 5 as having more serious lameness, more persistent lameness. So whether that's a good result or not, I'll leave that for you to decide. But generally with surgery, that becomes much better. That goes up to 95% or so, maybe even more. Now, if we go on to larger dogs, so those over 15 kilos or over 30 pounds, then they really don't do well without surgery. If we're resting it, once it eventually stabilizes, then the amount of arthritis present, it will just be so much worse than it would otherwise have been, and it will be crippling. There will be serious problems. And remember, very often these are young dogs as well. Not always, but often they're young or middle-aged dogs, so they've got a long life in front of them to live with an awful lot of pain. Also, if we're then giving them painkillers for a long period of time before we otherwise may have had to, then the cost of that can actually be more potentially than the treatment, so that the surgery. So that's something to bear in mind as well. Now, going back to braces, it may be that a brace does help, but like I say, I have my doubts. And again, if you go online and you look for these things, they can cost anywhere from several $100s to $1,000. And we have to ask the question, is this money going to be better spent on treatment that we know benefits the individual potentially an awful lot better? So like I say, we don't know the answer to this, or I certainly don't know the answer to this, and I'm not aware of any good studies that have been done, but that's really my concern, that we might be, wasting money when it would be better used on another treatment modality. Now, of course, I'd love a study to be done on this with knee braces, because cruciate ligament rupture is really such a common problem, and if we have different ways to manage it that maybe are more affordable or more effective in certain conditions, then that would be fantastic. Okay, so question number 3 is all about what should we feed a cat. So this new cat owner had an older cat that died, who was 18 years old and was fed mostly on a dry food on advice of their vet. So 18 years old is a very respectable age. They fed her according to her weight twice a day, and she was in really good health and an ideal weight for the vast majority of her life. But they've just got a new kitten, and they're wondering, what should they feed and how much should they feed her? Should it be wet food, dry food, raw, a mixture? What's the best thing? Well, let's start with the fact that feeding and food in cats and dogs can be a really controversial subject. But, here's my kind of brief summary opinion. And, I'd be really interested to hear what you think of this as well. As far as what amount we need to feed now, obesity is a huge epidemic. So many cats and so many dogs are obese. It's just really very tragic, and they're not living the life that they want, and they're getting diseases that they shouldn't have to. So really the amount we feed is as much as she needs and no more. Really, we need to base that on monitoring weight trends and body condition scoring. So that's something that the veterinary team can go through. The vet techs and vet nurses are fantastic at monitoring weight and maintaining weight, and very often clinics are running weight clinics as well. Also, ask your vet what your cat's ideal weight is when they're next in for their next checkup. That's something that we really need to be discussing in any wellness consultation. We want to be evaluating weight and checking that our pets are a healthy weight and not kind of creeping up, because it's very easy for a little bit of a creep to take place over a number of years, and before you know it, you've got a cat who's overweight or even morbidly obese. You can also obviously monitor weight at home, and we monitor that on bathroom or kitchen scales or something like that. So, we need to feed the amount that an individual cat needs, and there's going to be a huge variation. So I often find that if you're feeding a commercial food, then the pet food manufacturers, will slightly overestimate the amount to feed, unless your cat or your dog is very active. So we need to feed appropriate for the individual lifestyle and the individual genetics as well. Now, if we're thinking about actually what to feed, well, I don't recommend raw feeding, and that's for a number of different reasons. It's a health risk to us as their owners, albeit a low health risk. It's potentially serious, as well as being health risks to any raw fed cat. And I've actually got a comprehensive article kind of about all of these risks and benefits and discussing this over on ourpetshealth.com or on the Our Pets Health podcast. Now, I feel dry food is fine to feed a healthy cat. This is something that, again, people get very passionate about, and will claim that if they're developing certain conditions such as kidney disease because they're being fed a dry food. But really that doesn't follow. There's no evidence for that. If a cat does have kidney disease, then wet food, it is going to be generally preferred. Well, it's going to be definitely preferred if at all possible. But that in itself doesn't mean that dry food causes these problems in otherwise healthy cats. Now, one thing to bear in mind if you are feeding dry food is that cats can become kibble junkies, so they'll only ever then eat dry food if that's all they're ever used to. So I definitely think it's a good idea if you are feeding a dry food, if you're choosing to feed a dry commercial kibble, then it's a good idea to also feed some wet food of different textures, different consistencies and different flavors every now and then, just to help avoid your cat becoming a dry food addict. Now, let's moving on to wet feeding. Now, feeding a wet food is never going to be the wrong thing to do. It encourages water intake, which is something cats aren't very good at. A normal healthy cat is able to compensate for a low water intake, because in the wild, in the desert where they originate, then they don't generally get a lot of water. So they're just they're used to drawing a lot of water out of their food. But if we're giving them a wet food, they're definitely going to have enough water. We don't need to worry about that. And then if they do develop a condition later on that means that we need or that we want them to have a high water intake, so be that kidney disease, be that diabetes, then they're already being fed and they're already happy to accept a wet food, which can be very important. But, there are also other ways to get cats to drink as well, which I've discussed separately elsewhere. So, that's kind of my very broad summary on feeding. I don't recommend raw. I don't think inherently for every cat that a dry kibble is bad. And actually, I do feed my cats a dry kibble, but equally, we should be feeding wet food every now and then just to make sure that they're used to that. And if you want to feed a wet food, then that's never going to be the wrong thing to do. So potentially that's therefore the best thing to do. I'd love to hear your thoughts on this potentially controversial topic.
Ask your question at dralexanswers.com.
So moving on to question 4, we've got a cat who has kidney disease. They've got really high levels of creatinine and urea and SDMA in their blood. So those are parameters or markers of the kidneys potentially not working very well. Certainly with SDMA, we can get a high urea and creatinine with a dehydrated cat. But anyway, their cat's been diagnosed with kidney disease. She's going on IV fluids to try and flush out the system, to try and get those levels down. And the vet is anticipating that's going to take 4 or 5 days to happen. But the vet doesn't have overnight care. So what are the options really? What's the likelihood of another vet taking her on where they won't have to spend, extortionate amounts of money? And certainly after hours care overnight can cost an awful lot in some situations. So let's start with the fact that IV fluids, they are often needed for a cat with kidney failure when they become unwell. And certainly this can sometimes be the first presentation and the first hint that there is a problem with the kidneys going on. Now, so long as the damage is not too advanced, then these cats can do very well with this treatment. The IV fluids flushes the system. It flushes all these toxins out of the system. It gets a cat eating again. They feel a lot better. They start eating. They get put on appropriate treatment, which is often dietary management, treatment to control blood pressure, treatment to stop protein leaking out through the kidneys, control nausea, anemia, all these other things. They can do very, very well is the bottom line. So it's definitely something that's appropriate and worth pursuing. IV fluids, intravenous fluids, they are not risk-free if a cat is left unattended. If too much is administered too quickly, then ultimately they can effectively drown a cat. The excess fluid builds up in the lungs, that compromises their ability to breathe, and they effectively drown. And also we need to think then that a cat with kidney failure is more sensitive to these excess fluids. In a normal healthy patient, while they can still get what we call fluid overloaded, the kidneys are able to cope and they're working really well, and they're able to kind of pump out and get rid of this extra water that's being administered through the IV drip line. But in a cat with kidney failure, that's something that they're not able to do. So the risk, though, of this is still very low, so long as caution is taken. So we want to give fluids at a rate that is rehydrating the patient, but we don't want to overdo that. And really, this fluid overload, it's very unlikely if an appropriate rate is chosen and a fluid pump is used, compared to just using a kind of gravity-fed drip line. Unless, of course, there's an equipment failure and the fluid pump breaks and starts pumping excessively. But really, that's the chances of that are really, really slim. So the most likely thing if a cat is left overnight is that the fluids will become blocked. So that therefore obviously not get the benefit of those fluids until the blockage is cleared in the morning. But that in itself isn't necessarily a dangerous situation, so long as they're not blocked for a 24-hour period, which is obviously not going to happen. There's never going to be a situation where a cat is left for that period of time. Certainly depending on the office hours, it could be 14 hours, but so long as the fluids are running for a little bit, the period of obstruction is unlikely to be for more than a few hours. But that's something to bear in mind. So really, when it comes to overnight care options, you need to talk to your vet about what the options are. So they may be happy for your cat to stay in their hospital overnight, so long as you accept the fact that there is a risk, albeit a very, very small risk involved with that. I currently work in an area where there's no 24-hour emergency clinic, or there's no overnight emergency clinic. And so this is what routinely happens to patients over here, is the fact that they are left overnight, they're left on an appropriate rate of fluids, and it's a very similar situation to what this cat may be going through. And really, apart from the catheter becoming blocked overnight, never had any problems at all. Now, that's not to say that they're never going to happen, but the chance of that is very slim. They may be, your vet may also be able to advise you on a different low-cost option for your area where your cat can be transferred overnight. So there might be different options there that's not an expensive emergency clinic. But then the other option, or the only other option that doesn't involve an overnight expensive stay or transfer, is accepting that your cat might only be able to be on fluids over the day and then has to go home at night. So that's, another thing to consider. Is it ideal? No, it's not ideal, but it's certainly something to think about. And then when you're at home, if you are doing this, when you're at home, there are a number of other ways that you can try and maximize water intake. There's a number of ways we can do that, like I say. One thing to think about, certainly in kidney disease patients, when they may not be eating very well, is actually giving subcutaneous fluids. That's something that can be done at home. It's a case of giving fluids under the skin, and it can work, reasonably well in this situation. It's nowhere near as ideal as intravenous fluids, but it's definitely something to consider. So really the take home is talk to your vet about the different options. There are definitely other options out there. They may not be quite ideal. They may come with a slight risk, or they may not give the full benefit, but there are definitely other options if you're not able to afford or not wanting to afford the high cost that can be involved with 24-hour care. So remember that the information that I give in these podcasts is not a substitute for a consultation, an examination with your pet's veterinarian, and should not be taken as specific advice for any individual pet. If your pet is unwell, injured, or suffering from any kind of problem, then talking to your vet is always the best course of action. My final question is it okay that a dog has been injected with an anti-rabies shot at the age of 2 months? Well, age of vaccination is definitely something to think about, and really different vaccines are licensed for use at different ages and with different protocols. So it really depends on the vaccine. Then depending on which country you're in, which state you're in, certainly if you're in the US, then there are then different legislative requirements which detail when rabies vaccination must be given. And these two things aren't always the same. So the vaccine license doesn't always tie in with the state legislation. So it might be that a vaccine is able to be given earlier, and it's actually maybe beneficial to give it earlier, but then the state legislation requires that a vaccine is actually given a little bit later. So that may mean that you decide to give a pet more vaccines than they may strictly need, just to satisfy that early risk while they're young, and also the legislative requirements as well. So with the rabies vaccines that I'm familiar with, they can definitely be given from as young as 4 weeks of age, but they'll always require that final initial vaccination course, or even single vaccination, to be given at 12 weeks of age or older. So if a dog is being vaccinated at a younger age, so at 2 months here, so 8 weeks, then they will need a second vaccination at 12 weeks of age or older, like I say, to also comply with that state legislation. And really, it's a risk-benefit assessment. So we want to give the vaccinations that a dog needs without over-vaccinating. So if the risk of rabies is incredibly low, so if you're actively supervising your young puppy, you're not letting them mix with wildlife or unknown dogs, other unknown animals, then giving an earlier vaccine is probably not going to be needed, because the risk of them contracting that disease, and this is the same with parvovirus or distemper or any of other of these kind of vaccine preventable diseases, then if there's really a low risk, then we don't need to worry about vaccinating them really early. Having said that, if there is a risk, if there is known problem in the area, if there's a outbreak, if there's a flare-up, or if the lifestyle of you and your dog means that they are going to be in high-risk situations, then getting them that earlier vaccine is definitely going to be beneficial, because with a lot of these diseases as well, really young pups are super sensitive to these things, and they have often have a high fatality rate. Obviously, rabies has pretty much 100% fatality rate anyway, but certainly if a dog has got rabies, then they're going to need to be euthanized, because that's a massive human health risk, and that's something we definitely don't want to overlook. So really talk to your vet about the local risks for your dog in conjunction with your lifestyle as well, and then also discuss what the legislation means that your dog will need later on if they have had that earlier vaccination. So we definitely want to think of both of those things so that your dog is both safe and also complies with whatever laws are around where you live. Right, so that's it for this episode. I hope you found it helpful, interesting, or entertaining. And if you have, then I'd be really grateful if you could share it with your friends and family on the social platform of your choice, be that Facebook, Twitter, whatever, email them, WhatsApp. Remember too to head over to dralexanswers.com where you'll find the links that I've mentioned and downloads that I've mentioned in today's show, and you could also submit any question that you might have. But until next time, take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.